Hi, I'm Dr. Promila Mehan, and in this video I would like to talk to you about sleep disorders in children. Now, I've talked a lot about sleep disorders in adults, but what about children? Do they suffer from sleep disorders? Well, when I see my adults that have now been diagnosed with apnea, who come to me presenting with worn down teeth, cracked teeth without any apparent reason, TMJ problems, headaches, it makes me question why. Why are you suffering so much? How did this all begin? Well, the answer to the why usually takes me back to their childhood. Remember, apnea is a chronic condition, meaning that it's been there for a very, very long time. And for many people, this all began as limitations in breathing in childhood, which progressed over time into becoming apnea. Breathing is the keystone for normal facial growth and development in children. Proper nasal breathing will allow for the development of the midface, which is a part of our face that houses our nasal cavity, and allows our jaw, our mandible, to grow in a downward and forward trajectory, which is ideal to create a lot of space for the airway at the back and for creating space for our tongue. At rest, when you're breathing, your mouth should be closed and your tongue should be resting against the roof of your mouth. It is estimated that 80% of people that mouth breathe at night also mouth breathe during the day. And 1 in 4 children probably breathe through their mouths when they sleep. Now, for children, when they're mouth breathing, it isn't a mouth wide open when they're sleeping or resting. For children, it tends to be just a slight parting of the lips, just a tiny little crack in their lips. But even that little bit of mouth breathing can significantly impact their sleep. So why do we need to sleep? Recovery of our muscles and our body from our day's activities. Restoration and rebalancing of our hormones and our chemicals, getting everything back to beginning points, getting everything back to normal so that they're ready to start the new day. Immune function. It's during sleep that our brain rebalances our hormones and rebalances our cortisol levels and our blood sugar levels and gets rid of the inflammation so your body's ready to fight infection and raring to go for the next new day. And memory consolidation. Your kids learn so much and at such a rapid rate during that phase of their life that we need to sleep to store our memories and to create space for new memories. So how do you know if your child has a sleep disorder? Well, consider some of these questions. Does your child snore? Snoring always indicates that there is some form of restriction in breathing while sleeping. If your child can fall asleep, do they wake up in the middle of the night and have a really hard time going back to sleep? Does your child mouth breathe? Now remember, 80% of people that mouth breathe at night also mouth breathe during the day. So you don't need to set your alarm for the middle of the night to check on this. You can actually just observe your child during the day. When they're watching TV, when they're resting, reading a book, playing a game on their phone. At rest, your mouth and your lips should be closed. So observe, is their mouth slightly parted? That could be an indication that they're also mouth breathing at night. Do they wake up with a dry mouth or bad breath? Do they wake up with headaches, feeling groggy and tired in the mornings? Have you noticed them pause while they breathe? Have you actually witnessed an apneic event, very serious in a child? Are they really restless and agitated when they're sleeping? Do they go to the bed with their head on the pillow at the headboard, and in the middle of the night the bedclothes are all off of the bed or crumpled up in the middle of the bed? Or have they done a 180 and now they're sleeping at the foot of the bed? Restless sleep tells us that they're not getting into their deep restorative sleep. And do they tend to be prone to respiratory infections? Any and all of these symptoms are indications that there are some sleep problems with your child. Now, for most children, they don't even understand that there's something wrong with their sleep. For a lot of them, ever since they've been aware of themselves, they've always woken up with a headache or feeling tired and groggy. For many kids, it's just a part of their normal. And quite often, it isn't until the age of 10 or 12 that they start questioning and understanding that something doesn't feel quite right. So definitely kids do suffer from sleep disorders. Let's work together. Let's do everything we can to give your child the best chance possible to grow and to fulfill their potential. Thank you for watching this video, and please subscribe to this channel for more sleep health information for children.